Hello, I am Dr. Cristina Navarro, and what you are about to hear in the next few minutes has transformed the intimate lives of thousands of men who had already lost all hope. Men in their 60s, 70s, 75s, and 80s who came to my office convinced that their sex lives were over forever. And not only did they regain erections, they regained their confidence, their self-esteem, their relationships with their partners, and something many don't dare say out loud, they regained their will to live. Stay with me until the end of this video because I'm going to give you the complete protocol with exact measurements, precise timings, important warnings, and everything you need to know to apply it safely. Don't leave before the end because the most important information is in the second half. Before diving into the topic, I want you to know who I am and why I took the time to record this video. My name is Cristina Navarro. I am a doctor and I have been working exclusively with men over 50 for more than 20 years. I don't work with women. I don't work with young people. My specialty is mature men, their specific health issues, their hormonal changes, their circulatory problems, and especially everything related to male sexual health after 50. In 2 decades, I have treated thousands of men, and I can tell you with absolute certainty that erectile dysfunction is the #1 problem that most emotionally affects men of this age. Not pain, not fatigue, not anything else. The loss of an erection is what destroys a man from the inside, and most suffer in silence because they don't know who to talk to about it. I recorded this video because I want that information to reach more men. Because in my office, I can only see a few, but here I can speak to thousands. And if this video changes even one person's life, it will have been worth every minute. With that said, let's get to the topic. To understand why baking soda can help with erections, you first need to understand how an erection works, because many men don't know it clearly. And without understanding it, it's hard to make smart decisions about how to improve it. An erection isn't a mystery, it's a hydraulic process. The penis contains 2 structures called corpora cavernosa, which are like 2 spongy cylinders that run along the length of the penis. When a man gets aroused, the brain sends a signal to the parasympathetic nervous system, which is the system of calm and rest. This signal causes the blood vessels in the penis to relax and dilate. Blood rushes into those corpora cavernosa, filling them up and compressing the veins that drain blood from the penis. As a result, blood enters but can't leave, and the penis becomes erect and firm. This process depends on several factors that must all work well at the same time. First, the arteries that carry blood to the penis must be clean, flexible, and able to dilate. Second, the nervous system must be in calm mode, not alert or stress mode. Third, there must be enough nitric oxide, which is the molecule that signals the vessels to dilate. Fourth, hormone levels, especially testosterone, must be in an adequate range. And fifth, the body's pH, that is, the level of acidity or alkalinity in the blood, must be balanced for everything else to function properly. When one of those factors fails, the erection fails, and with age, several of those factors start to deteriorate at the same time. Arteries harden, chronic stress activates the alert nervous system. Nitric oxide production drops, testosterone decreases, and blood pH tends to become more acidic due to diet, sedentary lifestyle, stress, and metabolic changes inherent to aging. This is where baking soda comes in. Baking soda is an alkaline substance. When consumed in the correct dose and in the right way, it helps slightly raise the blood pH, counteracting that chronic acidity. And when the pH balances out, several important things happen. Blood vessels regain some of their flexibility. The response to nitric oxide improves. Blood flows with less resistance, and the penile tissue, which is extremely sensitive to circulatory changes, starts receiving better blood supply. I'm not saying baking soda is a cure, it's not. I'm saying it's a metabolic tool that, when used correctly, can improve the body's circulatory environment and, as a result, promote firmer and more consistent erections. And what I like about this tool is that it's accessible to everyone. It costs almost nothing. It's in any supermarket, and when used with the correct protocol, it has no side effects in healthy people. Now, let's get to the details, because details are everything in medicine. An incorrect dose can be ineffective or harmful. The wrong timing can reduce the effect, and the wrong duration can create problems you didn't anticipate. So pay close attention to what comes next. The first thing is the type of baking soda. This is fundamental, and many people ignore it. The product you need is pure baking soda. Just that. Not baking powder, which in English is called baking powder because that product contains baking soda mixed with tartaric acid or other ingredients we don't want to introduce into the body. Not flavored baking soda, not effervescent baking soda with additives, just pure baking soda with nothing else. You can find it in the baking section of any supermarket or in pharmacies. The packaging should say only bicarbonato de sodio or sodium bicarbonate if it's in English. Read the label and verify that the only ingredient is that. Second point, the dose. This is the most critical point and where people make the most mistakes. The dose we're using is half a teaspoon. The small one, not a tablespoon or dessert spoon. The little spoon you use to stir coffee or tea. Fill it halfway without overflowing. That equals approximately 2 grams of pure baking soda. 2 grams, that's the number I want you to remember. If you have a precise kitchen scale, which are very affordable today, you can weigh exactly 2 grams. That's ideal. If you don't have a scale, half a coffee teaspoon is a sufficiently accurate approximation. I want to be very clear about this. Don't take a full teaspoon, don't take a tablespoon. Don't think that if half a teaspoon is good, more will be better. That reasoning is dangerous, and I'll explain why when we get to the negative effects of excess. For now, stick with the number 2 grams, half a coffee teaspoon. Third point, the water. Dissolve those 2 grams in a normal glass of warm water, the kind we use every day, about 200 milliliter or a bit more. The water should be warm, not cold, and not hot. Warm like something comfortable to the touch. Warm water dissolves the baking soda better and also facilitates its absorption in the stomach. Stir with a spoon until the baking soda completely disappears in the water. There should be no lumps or powder at the bottom. When the water is completely clear, it's ready to drink. Drink it slowly, not in one gulp, over 2 or 3 minutes. This prevents the baking soda from hitting the stomach all at once and causing gas or discomfort. Fourth point, the time of day. Baking soda works best on an empty stomach. The ideal window is in the morning on an empty stomach before breakfast. You wake up, prepare the glass, drink it slowly, and wait 20 to 30 minutes before eating breakfast. That time gives the baking soda a chance to be absorbed through the stomach wall before food arrives. However, some men have sensitive stomachs and feel discomfort with anything but water on an empty stomach. In those cases, the alternative is to take it 2 hours after the last meal of the day, preferably before bed. Always on a relatively empty stomach, never right after eating, because baking soda interferes with digestion and can reduce the gastric acidity we need to digest food properly. Fifth point, weekly frequency. This protocol isn't taken every day. It's 5 consecutive days followed by 2 days off. For example, Monday to Friday, you take the glass of baking soda in the morning, and Saturday and Sunday, you rest. Don't take anything those 2 days, then start again on Monday. The 2-day rest per week is essential. It's not optional. The body has its own mechanisms to regulate blood pH, mainly through the kidneys and lungs. If you introduce baking soda every day without stopping, those mechanisms start to depend on the external input and lose efficiency. The 2 days off force the body to activate its own regulatory systems, which in the long run makes it more efficient and healthier. 6 point. Cycle duration. A complete cycle of this protocol lasts 8 weeks, 2 months. During those 8 weeks, follow the rhythm of 5 days on and 2 off each week. At the end of the 8 weeks, stop completely for 1 month, 30 days of total pause, without taking baking soda at any time. That month of pause isn't wasted time, it's consolidation time. The body needs that time to settle the metabolic changes that occurred during the 8 weeks so that the blood vessels that regained flexibility maintain it stably, and so the kidneys can process and eliminate any excess. After that month, if your doctor deems it appropriate, you can repeat the cycle. Now, I want to talk about who can use this protocol and under what conditions, because not all men are in the same health situation, and the same dose that's safe for one man may not be for another. The ideal man for this protocol is one with erectile dysfunction of vascular or circulatory origin, without serious underlying diseases, or with mild, well-controlled ones. Vascular origin erectile dysfunction is the most common after 50. It's characterized by erections that take longer to appear, that don't reach the previous firmness, that are lost during the act, or that simply don't happen anymore. If that's your case, this protocol is designed for you. Men who feel general fatigue, have poor circulation in their legs, often have cold feet or hands, have a tendency toward metabolic acidity from a diet rich in meats, dairy, refined flours, and sugars, and lead a sedentary lifestyle also benefit. All those are factors that baking soda helps counteract when combined with the lifestyle changes I'll mention. Now, for the special conditions that require adaptation or prior medical consultation. If you have high blood pressure that is diagnosed hypertension and you're taking medication to control it, you need to talk to your doctor before starting this protocol. The reason is that baking soda contains sodium, and although the amount we're using, 2 grams of baking soda contains about 550 milliquarquars of sodium, which is a relatively low amount. In people whose blood pressure is very sensitive to sodium, it could cause an elevation. Most hypertensives on treatment can tolerate this amount perfectly, but the decision should be made by your doctor knowing your specific case. If you have chronic kidney disease in any stage, this protocol should not be used without direct medical supervision. The kidneys are the main regulators of blood pH, and if they're functioning below a normal capacity, they may not handle the additional baking soda well. The result could be alkalosis, which is a pH that's too high, with consequences we'll see in a few minutes. If you have heart failure or if your doctor has told you to restrict sodium in your diet, consult before starting. Fluid retention that can occur in heart failure can worsen with the sodium from baking soda. If you have controlled type 2 diabetes, you can use the protocol, but with some adaptations. First, always take it in the morning, never at night. Second, monitor your glucose more frequently during the first 2 weeks, especially if you use insulin or glucose-lowering medications, because the pH change can slightly alter how those medications work in the body. Third, inform your primary care doctor or endocrinologist that you're following this protocol. It's not dangerous for diabetics, but your doctor should know for a complete picture of your health. If you have high cholesterol or arteriosclerosis, which is the hardening and thickening of arteries due to plaque buildup, baking soda can be a valuable support, but it doesn't solve the underlying problem. Arterial plaque doesn't disappear with baking soda. What improves is the metabolic environment around that plaque, the flexibility of the arterial wall between plaque areas, and overall blood flow. In these cases, the protocol should be part of a broader plan that includes any medication your doctor has prescribed, progressive exercise, and an anti-inflammatory diet. If you're taking medications for erectile dysfunction, like sildenafil, known commercially as Viagra, or tadalafil, known as Cialis, baking soda has no known direct interaction with those drugs. However, I don't recommend combining them without medical guidance. Not because it's necessarily dangerous, but because the long term goal should be to improve baseline circulation so you need less pharmacological support over time. Using everything at once doesn't help you understand what's working and what isn't. If you have severe gastroesophageal reflux or active gastric ulcers, the protocol needs adaptation. Although baking soda relieves heartburn short term due to its acid neutralizing effect, continued use can cause a rebound effect. The stomach detects the alkalization and compensates by producing more acid, which can worsen reflux in the long run. In these cases, the adaptation is to take the baking soda always at night on an empty stomach, reduce the frequency to 4 days a week instead of 5, and use a slightly lower dose, around 1 gram instead of 2. Now, I want to talk about something that, in my experience, is one of the most ignored points when people use these types of protocols: the negative effects of excess. This is crucial, and I want you to understand it well before starting. Baking soda is safe within the correct parameters, but if you increase the dose, eliminate the rest days, or use it longer than indicated without a pause, serious